SPINRAZA, nusinersen, was the first treatment indicated for pediatric and adult patients with spinal muscular atrophy, or SMA. SPINRAZA addresses an underlying cause of SMA by increasing the amount of functional survival motor neuron, SMN protein. SMA results from a lack of the SMN protein. While lacking a functional SMN1 gene, patients with SMA have one or more functional copies of the SMN2 gene with the capacity to produce functional SMN protein. To make SMN protein, these genes are transcribed into pre-mRNA, containing both the coding regions, or exons, and the non-coding regions, or introns. Then the pre-mRNA undergoes splicing to remove introns and create mature mRNA that can be translated into protein. SPINRAZA is an antisense oligonucleotide, ASO, targeted to SMN2 mRNA that promotes proper mRNA splicing to increase SMN protein expression. SPINRAZA is taken up by neurons where it enters the nucleus and specifically binds to the SMN2 pre-mRNA downstream of exon 7 in a sequence-specific manner. This is an intronic silencing sequence that regulates splicing of exon 7. The binding of SPINRAZA to this region prevents the association of heterogeneous nuclear ribonucleoproteins, HNRMP, resulting in production of mature SMN2 mRNA containing exon 7. By increasing the proportion of SMN2 mRNA that includes exon 7, SPINRAZA increases production of full-length functional SMN protein. Increased amount of SMN protein has been demonstrated in the central nervous system of SPINRAZA-treated transgenic mouse models. Additionally, increased full-length SMN2 mRNA and SMN protein were seen in spinal cord tissues taken from 3 infants treated with SPINRAZA that participated in a Phase 2 clinical trial compared with untreated infants. SPINRAZA efficacy was demonstrated in the pivotal Phase 3 clinical trials in DEER and CHERISH and supported by open-label studies in patients who had or were likely to develop type 1, 2, or 3 SMA, who were as young as 3 days and up to 16 years of age at first dose. Indication: SPINRAZA is indicated for the treatment of spinal muscular atrophy, SMA, in pediatric and adult patients. Important safety information. Coagulation abnormalities and thrombocytopenia, including acute severe thrombocytopenia, have been observed after administration of some antisense oligonucleotides. Patients may be at increased risk of bleeding complications. In the sham-controlled studies for patients with infantile onset and later onset SMA, 24 of 146 SPINRAZA-treated patients, 16%, with high, normal, or unknown platelet count at baseline, developed a platelet level below the lower limit of normal compared to 10 of 72 sham-controlled patients, 14%. 2 SPINRAZA-treated patients developed platelet counts less than 50,000 cells per microliter, with the lowest level of 10,000 cells per microliter recorded on study day 28. Renal toxicity, including potentially fatal glomerulonephritis, has been observed after administration of some antisense oligonucleotides. SPINRAZA is present in and excreted by the kidney. In the sham-controlled studies for patients with infantile onset and later onset SMA, 71 of 123 SPINRAZA-treated patients, 58%, had elevated urine protein compared to 22 of 65 sham-controlled patients, 34%. Laboratory testing and monitoring to assess safety should be conducted. Perform a platelet count, coagulation laboratory testing, and quantitative spot urine protein testing at baseline and prior to each dose of SPINRAZA and as clinically needed. Severe hyponatremia was reported in an infant treated with SPINRAZA, requiring salt supplementation for 14 months. Cases of rash were reported in patients treated with SPINRAZA. SPINRAZA may cause a reduction in growth as measured by height when administered to infants, as suggested by observations from the controlled study. It is unknown whether any effect of SPINRAZA on growth would be reversible with cessation of treatment. The most common adverse reactions, greater than or equal to 20% of SPINRAZA-treated patients and greater than or equal to 5% more frequently than in control patients, that occurred in the infantile onset controlled study were lower respiratory infection and constipation. Serious adverse reactions of atelectasis were more frequent in SPINRAZA-treated patients, 18%, than in control patients, 10%. Because patients in this controlled study were infants, adverse reactions that are verbally reported could not be assessed. The most common adverse reactions that occurred in the later onset controlled study were pyrexia, headache, vomiting, and back pain. Post-lumbar puncture syndrome has also been observed after the administration of SPINRAZA. Please see full prescribing information via the link provided for additional important safety information.